Hi everyone, Dr. Hall, and now we're going to do a clay model of the female external genitalia. So as I always talk about in class, when we're doing a clay model, we want to start with the deepest structure and then build up from there. So what we're going to start with is the clitoris. So the clitoris is actually a kind of a wishbone shaped structure. So I'm going to create something that looks kind of like a wishbone. And it's composed of erectile tissue. In fact, it's composed of the same type of erectile tissue as the corpora cavernosa in the male penis. So when we are fetuses in the womb, we all start with exactly the same progenitors of external genitalia. So what becomes part of the penis in a male-bodied person is going to actually become part of the clitoris in a female-bodied person. So it's kind of a wishbone-shaped structure like this, composed of erectile tissue. And when those two come together at the top, it extends anteriorly like that. So we have different parts of the clitoris. This part is the glans, which is interesting, right? Because the tip of the male penis is called the glans. We have the glans clitoris, then the body, and then these two arms that go out to each side are called the crura. So again, we're using the same type of terminology because it really is the same tissue, just differently sized and differently organized. So there is our clitoris. The other structure that we're going to find deep in the female external genitalia is another set of erectile tissues, one on each side, called the vestibular bulbs. And so the vestibular bulbs actually develop from the same erectile tissue that in male-bodied people forms the corpus spongiosum. So we have two vestibular bulbs located on each side, just like this. Mine are a little large, but that's okay. So we have our vestibular bulbs, one on each side, also composed of erectile tissue, so they will engorge with blood and thicken and enlarge with arousal. Just inferior to the vestibular bulbs, we're going to find the vestibular glands, also sometimes called Bartholin's glands. So vestibular glands or Bartholin's glands, both terms are correct. And so they're going to be located right at the inferior aspect of the vestibular bulbs. So we have the glans, body, and crura of the clitoris, vestibular bulbs, and vestibular glands. So the vestibular glands are going to produce a moisturizing substance, or a lubricating substance, during arousal, which will then be secreted through little ducts near the opening of the vagina. So now I'm going to create the orifice or opening of the vagina. And so the vagina is a fibromuscular tube. And so I'm just going to be representing the proximal most aspect, like that. Okay, and these are going to come out near the opening of the vagina. That's a very thick-walled vagina, but that'll work. Also here, we're going to have the opening to the urethra, which is, of course, a separate tube from the vagina. Unlike the male, where the urethra serves double duty for both the urinary system and the reproductive system, in the female, they are separate structures. Right, so we're also going to have the urethral opening. That's a little too large. It's pretty small, right? Much smaller tube than the vagina. So here's the opening of our urethra. And you might recall from when we did the internal reproductive structures of the female that we had some glands located in between the vagina and the urethra called Skene's glands. And so I'm going to make two little Skene's glands here, each with a duct, and they open out just either side of the urethral orifice, or the urethral opening. And so these glands in most female-bodied people are not very active, but in about 15, we don't think anyway, in about 15 or so % of female-bodied people, these glands, Skene's glands, can sometimes secrete fluid with orgasm. So that's responsible for the phenomenon of female ejaculation. So clitoris, vestibular bulbs, vestibular glands, aka Bartholin glands, vaginal orifice, Skene's glands, urethral orifice. So now we need to add the labia. So the labia minora cover, let's see if I can make these big enough, cover all of these structures that we've just discussed. So they are folds of a very interesting and kind of delicate skin. It's not as keratinized as kind of regular skin. It's almost a little bit membranous, okay? And so there are our labia minora. At the top of the labia minora, we can see that the clitoris, just the glands of the clitoris, is visible. And the glands of the clitoris also has a little hood of skin that covers it, which is called the prepuce, or the clitoral hood. So just like in the male, where the glans penis was covered by the prepuce or the foreskin, in the female-bodied person, the glans clitoris is covered by a prepuce or clitoral hood. So now we need to add our labia majora. I've created those in advance. And these are made of what we would think of as kind of regular skin. So normal keratinized hair-bearing skin right there. And then we just have a few more structures to add. One is that up top here, I don't have enough clay, but up top here is what's called the mons pubis, and it's an area of skin where there's a fatty pad underneath to kind of cushion the pubic symphysis for intercourse, which is handy. We also have our blood vessels and nerves. And so the supply to the female external genitalia for the neurovascular supply is coming from the internal pudendal nerve, artery, and vein. And they're going to be coming in like this. We also then have an area of skin between the vulva, which is this entire structure and its contents, and the anus, which I will make a little anal opening here. And this stretch of skin in between the vulva and the anus is called the perineum. The perineum is this stretch of skin right here in between the anus and the vulva. So a quick review. Anus, perineum, internal pudendal nerve, artery, and vein supplying all of these structures. Labia majora, labia minora, clitoral hood or prepuce, glands, body, and crura of the clitoris, urethral orifice, Skene's glands with their openings, vestibular bulbs, vagina, vaginal introitus or orifice, and vestibular or Bartholin's glands with their openings either side of the inferior aspect of the vaginal opening. And that's it.